All right, this is a training video for those of you who are learning how to do spinal decompression here for the low back. This is what this video will show. We're going to talk about how to do that from start to finish so that you guys can do this exactly how it should be done every single time. The important thing is, number one, we're trying to treat somebody to get better, but even if they don't get better, we don't want to make them worse, right? And you can definitely hurt somebody on this machine, so we want to make sure that you're doing it correctly every time. All right, so the first thing you want to do, just anatomically looking at this table, there are two gaps in the table. There's one here and there's one here. The strap and the low back brace should be kind of laying over this one on the right. This second one should be exposed. Every time you go to the table, if this is down like this, you're going to have to rearrange the strap to cover that first gap. When you explain to the patient where they should sit, the corner of this black cushion right here. Don't sit here, don't sit here, you're just gonna waste time. You don't wanna sit down here, you wanna sit right here. They put their butt right there, their left hip, when they go to turn, is gonna be right where they need to be, okay? So go ahead, come on over here, Doc, sit right here for me. Perfect, he's in the perfect position, okay? We're gonna have the patient lay onto their back, face up. Go ahead and lay on back here. And he's a little bit low. And here's how you can tell. Raise your arms overhead. The first thing you're going to tell the person is raise the arms over their head. If these straps can't fit underneath his armpits, and it can't because he's not high enough, then we know he's down too low. So we're going to have him slide up 2 inches that way. You should tell the person to slide up. Keep the patient's knees bent because you're going to need them bent. Arms overhead, that looks pretty good. Now when we bring it underneath it, you can see it goes underneath his armpit. We're good to go. Relax your arms. The next thing is we want to make sure that the top of their hip bones are lined up perfectly with the middle of this strap. So when you look at this strap, the midline of the strap is the important delineation here, okay? So you want to make sure you get to feel in there. Don't be afraid to touch the patient. Get your hands on top, right above their belt line. You'll feel the top of their hips. There it is right there. You can see that that hip line is right down the middle of this. We're good to go, okay? If, by chance, slide down a little bit. If, by chance, his arms are pretty good, but you feel here, and you can see that the top of his hips are right here. Even with this, we're no good. No bueno. So slide back up to where you were. It's important that you get that line up just right. Okay? So we know the arms are good. We know that the hips are good. Now, the one thing I cannot show you here, based on how we're videoing this, is there is a V shape. Shoot, I'm just going to show you anyway. Let's do it this way. Underneath the patient, in their crotch, you see this V shape here. That has to be right in the middle of his crotch. Do you see it's off to the right a little bit, down the midline of him? So we want to move it this way a little bit. So lift your hips up for me. We're going to slide that over. Good. Back down. Now you see how I went too far? So now it's over here too far of the midline. Come back up, set it back down. Good. So now raise your arms overhead. We know we're good here. We know we're good here. And we know that we're good here. If those three things are not in place, you can relax your arms. If those three things are not in place, you cannot proceed, okay? Once you got those things in place, it's very difficult to hurt the patient, okay? That's important. Once you've done that, now we're off and running. You're going to get, Tatum, will you bring me a sticky note, please? You're going to have on the note written there, you're going to have 4 numbers on a decompression setting. You're going to have number of turns. That talks about this wheel right here. You're going to have degrees. That talks about degrees that the angle of the table is at. Thank you. You're going to have, missing the pen. Will you bring me a pen, please? You're going to have poundage, and then you're going to have minutes. Okay? And the poundage and the minutes you'll set up on the table over here. But the turns and the actual degrees, thank you, will be written as such. 2 turns. 10 degrees, 80 pounds, 25 minutes. Written just like this. 2 turns, 10 degrees, 80 pounds, 25 minutes. So the turns, we're going to deal with that last. The degrees we're going to deal with in just a moment. And here's what you're going to do next. You're going to have the patient move your arms, just lift your arms a little bit. Take a deep breath in. And breathe out. Perfect. You want to make sure that you strap that in as they're breathing out. Fully exhalation, so you can get that on as tight as possible. You want that to be on nice and snug. You're then going to use the belt, which is right here. Clips on one end, open strap on the other. Slip it through. Do both loops, come back through just one. And you want this ring to be right in the center of their hips. What do I mean by that? This ring needs to be right down the middle. See where that strap was? Right down the middle, that ring should be right there. If it's over to the left, when you go to do the decompression, it looks like that, you're going to hurt them. You're going to twist them. So you want to make sure you start with the ring in this position. Take a deep breath in, and then you're going to breathe out. Sorry for the visualization at home. There we go. And as I tighten that up, that ring is right in the middle. Okay, so as he breathed out, I was pulling this strap over here, pulling it down this way. And that pulls the ring from this vantage point, pulls it over to the center. And once that's in the center, you can see it right there. We're good to go there. You're going to take this clip right here. It's going to go into the ring underneath, and we're good. There's a little silver ring here. That's going to attach to the machine. So let me put you back onto the stand, and you can see that from back here. There's a rope release button on the lower right-hand corner of the screen. You're going to hold that down. Do not let go of it. You're going to pull this out. Then you're going to let go of that, and you've got this. Now you got it loose. If you don't hold on to this and you let go of that button, it's going to fling it right back in. It's almost like a fully extendable, but only the old vacuum cords. So you have to hold that in, pull the strap out, let go of that button, and now you got it as loose as you need to. You're going to strap the carabiner clip onto that ring I was showing you. Pull the rope tight again so there's no slack. Push this button, slowly let it feed back in. If you do not do that, it's going to zing back in really quickly. You're going to throw the cord off of its wheel, and then we're going to have to get the machine fixed. That's going to make for a very unhappy set of doctors. So, nice and easy, let it back in. Once we got that in, we're going to put these leg supports underneath their legs. The leg supports go against the wall. That's where they should be, side by side. This goes underneath one leg, drop your leg flat. You want to make sure the patient's legs are relaxed, okay? We don't want them propped up like this. We need that knee gap to drop down over that support, okay? Same thing with the other one. Underneath the knee, let it drop down. There we go. Got that done, okay? So we got him relaxed, and we got him ready to go with this. Now, we want to make sure that we also deal with the shoulders. We want to get that strap underneath him. So raise your arms overhead. Your Velcro. They're going to cross one over the other. Take a deep breath in. As he breathes out, you're going to pull it across him in an X pattern. Nice and tight. So that way he can't, this is going to hold him in place. There's two things that are to keep him in place. This strap and then the shoulder cushions. Shoulder cushions are found underneath the table. They're going to be kept right here at the head of the table. Pull them out. There's holes set in here, so you can see that at home. Let's be clear. There are holes right here, and you get to decide if somebody's really wide and really big, you may have to put the block way out here. But for Dr. Evan here, he's a thin guy. This will slide right in there underneath his armpit. Just like that. Put your arm over the top of that, Doc. There you go. Is that comfortable?
Yep.
Okay. We don't want to be up too high. So obviously you can actually spin this. Lift your arm up for me again. You can spin this so it's up, pushed up a little higher. Bring your arm over the top of that. That's a little high. It's going to be a little uncomfortable as he gets pulled this way. It's going to put pressure into his armpit. So you can spin it down. That should be better. Same thing with the other one. Lift the arm up. You can see those holes right there. We're going to choose that one right there. Oh, this one right here. Arm over the top of that. Good there? Mm-hmm. Okay, perfect. Now, we're going to deal with this angle of the table right here, okay? And to see that, you're going to have to look on the side here. That's 10 degrees. The line in between is 15, 20, 22, sorry, 25, and then 30 is right there, okay? And the ones you'll use the most are probably around 10, 15, and 20, okay? So to properly determine where that chord is, you have to sit about right here. You're basically at the foot end of the table where the feet are, and you're looking directly across. If you stand up here and look at it, you're not going to get the right measurement. I'm standing fully erect right here. You need to get down, squat down, so you're at the eye level with this, and you can see that's the angle. There's a pedal right here. Up and down. Push up. Up he goes. And we're going to keep going up. Sorry for the shaky camera. Since we're doing 10 degrees for him, we're getting pretty close. When we parallel with that 10, that's actually pretty close, right? 10, maybe up a little higher. Right there. 10 degrees. Okay? If you want to do 15, we want to bring it down to about right there. Down to 20. Bring it down to about right there. Okay? So in this case, we're at 10 degrees. We're going to go back up. Once you got him at 10 degrees, there we go. We're going to deal with setting up the actual weight. We talked earlier, 80 pounds. So we're doing low back traction. That's the lumbar. The other one you will use is cervical. That's for neck. That's a different protocol training. So lumbar traction. You're going to hit edit. And then you're going to hit a few different buttons. This is where you're going to set the maximum. The maximum was 80 pounds. So the 80 will go in this box right here. You tap on it. You're going to hit maximum level. You're going to hit 80. And then you're going to choose the minimum. The minimum is always half of the maximum. So in this case, 40. If the person's maximum was 24, then you'd have the minimum be 12. There we go. So half of the maximum. We're set. Go back arrow to get to the previous menu. 2 more things we have to hit. Speed, 50%. You can do 30%, but the patient probably wants to get as much decompressions out of this treatment as possible. So you'll get a lot more doing it at 50% speed than 30% speed. There's another setting that's 100%. It's too high. It's a little too fast. The body doesn't get to relax as much. So set it for 50%. Time is the last one. On here, we talked about 25 minutes. That's the default. As far as doctors, the machine's default is 15. So you usually have to change it out. So time, I'm going to set it for 25 minutes. We're going to clear it and hit 25. There we go. Now we're ready. The last thing we have to do before we hit the start button is we want to make sure we deal with the turns. 2 turns. Here's the ring right here. Now you can see from this angle, that's actually already somewhat elevated. I'm going to lower this down to where it's supposed to be at 0. Okay, that's at 0. It's totally flat with the other cushions. Okay, I crank it up quite a bit. You can just see. You can see the difference as it raises up. All right, it's a difference, right? We can change that angle as high as we want. So we're going to go back down to 0, where it's in neutral. Okay, so once you're there, once you start to turn it, you won't feel anything because there's no resistance for like the first couple of turns. All right, it's just a wheel in air. But then eventually you'll start to hit resistance. In this case, it's right. That's where the resistance is. You can start to feel the resistance, and it's going to start to turn this pad. That's where the turn starts. So you're going to go 1 turn. And the doctor said 2 turns, so we're going to the second turn. There's 2 turns, and it's elevated 2 turns. And then you're ready to go. You're going to hit the start button. Well, before you do that, the last thing is the unlock button. Right here, the unlock knob. Locked is counterclockwise. Unlock is clockwise. We want to lock it up when the person comes off the table. So that way this table doesn't slide when they get up. But when you get back a new patient on there, the table is going to be unlocked. You want to make sure it's locked first so it doesn't slide again when they get on the table. But it will not move unless you turn it to unlock. Otherwise, you're just going to be literally squeezing their waist and they won't be sliding anywhere. There'll be no decompression going on. It'll be a total waste of time and their money. So you want to make sure you turn that clockwise, get that to click, you're unlocked, and now you're off and running. You just have to hit the start button. Start button is right here. Start button. It says beginning traction. Ensure table is unlocked. Just in case you forgot, it reminds you, make sure you hit that unlock button. Then we're going. We've got our 10 degrees. We've got our 25 minutes right here. We've got our 80 pounds, and you can see it's already set. For 80 pounds, it's working its way up from 20 to 40 to 60 to 80, and it's going to ratchet its way up and then go down and come back up and then go back down. We're going to do that for 25 minutes, as it was stated right here. The turns are set by this, and then we're good to go. The person will be here for a total of half hour. So the patient says, how long am I going to be on here? From the point you get them on the table, get them all set up, hit start, get them off the table, and they're leaving, it's a half hour. So you can expect to be on there for a half hour. Okay? Now, pretend that this patient is all done. All right, so you're going to hear this thing beep. That's what it sounds like when the table is all done. That means there will be zero tension on here. The patient is all done. You can take them off. I'm going to get you set up over here so you can see how to take them off the table. Okay. So, first thing we want to do, we want to lock up the table because we do not want them to try and get up and then have this table slide underneath them, especially after they've just been done treating their low back. So we're going to lock up the table. Boom. We're going to get them as comfortable as possible, as quickly as possible. Arms up overhead. Out. Put them away. Strap. Take them off. We're going to loosen up this strap. We can't take this off until this is taken off. So again, we're going to push that rope release button. We're going to hold it. We're going to pull the cord out. Then we're going to release the rope release button. Hold, pull, let go. Now we've got slack. Unclip him. Again, hold this. Hold tight so you have no slack left. Hold down the rope release. Allow this rope to slide back in. Then let go. Done. Then you unclip him. Here. Undo the strap. Slide it out. Undo the Velcro. The last thing here, bend your knees up for me a little bit. Now, somebody who's been in a lot of pain and their low back just got stretched like this, it's going to help them, but it can be quite sore initially. It might be difficult for them to even bend their knees, so be patient. Take your time. Don't be in a rush. These, side by side, over against the wall. You're going to lower the table down because they're too high to even get their feet touching the ground when they sit up. When they sit up, you are not to try and help pull them up. It's nice to think that that would be helpful, but they should not do that. It's going to hurt their low back and possibly hurt yours. We don't need that, either one of those. So you tell the patient, roll over onto your side so you're facing me. Lift your knees together. And then I'll have you swing your legs off the table so your feet come down. Use your arm to help prop yourself up. That's how the patient should get up. Do not try to pull them up. Once they're there, if it's a little too low or too a little high, like if they're still a little, a little difficult, if they're a little taller guy, you may want to raise the table up a little bit so it's easier, so they're not squatting down like this on a low table. You can raise that back up a little bit if need be. But nonetheless, once they're there, they feel comfortable, they're up, they're off, they're gone. Okay? That's how to load and unload decompression table.